Thank you, Dr. Bedesi, and greetings of the day, whichever part of the world you are. It is my pleasure and privilege to introduce to you one of the stalwarts of public health in the Caribbean region and around the world. Dr. Joy St. John hails from one of my home countries, which is the beautiful Caribbean island of Barbados, or paradise, as we would say. Dr. Joy St. John is dedicated and reliable and has a track record of achievements in public health systems management and development and health diplomacy. Her firm but fair style has assured her a place in networks of practice across the world. Her most recent appointment is the Executive Director of Caribbean Public Health Agency, CARPHA. This was in July 2019. As the Executive Director, she provides leadership and direction to CARPHA in executing the functions laid out in the Intergovernmental Agreement. Along with the CARPHA team, Dr. St. John has led the public health response in the CARICOM region. She's the first Barbadian to serve as Assistant Director General of the World Health Organization, and this was during the period of October 2017 to April 2019. She had direct responsibility at the WHO for climate and other determinants of health, CED. She's also the former Chief Medical Officer of Barbados, and she's the first Barbadian to hold this office for over 12 years. She has been the top public health advisor to the Minister of Public Health and was responsible for the oversight of the management of the health sector. She was also the chairman of the executive board of the World Health Organization and is the first person from the Caribbean to do so. She held this position during 2012 to 2013. Please help me in welcoming Dr. Joy St. John. Thank you very much.
Thank you so much. So let me go right ahead and share my screen because I'm going to tell my story mainly in pictures. So you need to let me know if you're seeing it. Are you seeing it?
We can see here.
Yes, Atish?
Yes.
Wonderful. Okay, so let's go. So it is a great pleasure to join St. George's University at this virtual research conference. And I've been given the task of speaking about relevance, creativity, and innovation for public health practice and education. And specifically under that heading, the Caribbean and CARPHA's creative and innovative strategies as it relates to addressing the COVID-19 pandemic. First of all, let me say, I love that video. You need to spread it, not just to the conference participants, I really do. And I hope to cover all of these areas. And the reason why I've been so complete is because you spoke about innovation and creativity, and a lot of creativity has gone on in the Caribbean, not just at CARPHA, to deal with COVID-19. So a little bit about CARPHA. You can see that our vision is healthy people, healthy spaces, healthy Caribbean, even in a pandemic. And we are the amalgamation of 5 regional health institutions. And this is what we do, especially during this COVID time. Resource mobilization, risk communication, provision of advice to non-health sectors, and the coordination of the public health response, all within the framework of health security. And this is who we serve, 26 member states, many of which are overseas territories of the UK, and we also have Dutch. But we have 4 languages among our countries because we have Belize as well. So we've got Spanish, French, English, and Dutch. I only speak English. So the governance of this entire response has been very firmly at the national and regional level vested in the heads of government. And in fact, early on, the heads of government agreed to the development of a common public health policy, and they've demonstrated regional solidarity. So we've had 6 heads of government sessions, 2 sessions of the Bureau of the Conference of Heads, and 5 COSODs to give us direction on the public health response to COVID-19. So there's been policy approval of ministers of health, but the backbone of this whole response is the chief medical officers. And of course, the CARICOM Secretariat has had a hard job because they've had to convene all these many sectors, and they've also had to play a diplomacy role. But this altogether has been the governance of the CARICOM COVID-19 response. Now, this is a timeline, and we actually do keep up with both the cases and the documents that we produce. And I show you this timeline because we actually started working on what was necessary for approaching COVID-19 long before we even knew about it. And this is the security cluster, raised epidemics to higher in the risks and threats table. So even before we got a case, and even now that we've had cases, we've been working, producing technical guidance and support to the member states, but especially now that we are reopening our borders and trying to return safely to economic activity. So let me give you a little snapshot of where we are. So in the global context, and then compare it to the Caribbean. So although we are calling ourselves Caribbean, we're just one small section of the Caribbean. And in that small section with CARPHA member states, there have been 52,000 plus confirmed cases as compared to 277,000 in overall Caribbean, and as compared to 46 million globally. So as of November 1st, the CARPHA Medical Microbiology Laboratory has received almost 30,000 samples from 17 member states. This is cumulatively since the time we started testing. And we've got a positivity rate of 13.8. Now it's probably that high because there's a focus on populations or groupings like visitors where you may have positive cases. But still, the fact that it has been increasing is of note to us. So these are some rates of infection, and in comparison to the wider Caribbean, you'll see that we have a lower rate of infection at 257 per 100,000. And as compared to some other of our sending countries for tourism, it's a whole lot less, factors less. And I think what is of high importance to all of us, nationals and visitors alike, is the type of transmission. And we get this from WHO and they get it from the member states. So we've got 8 Caribbean states with community transmission, 6 with clusters of cases, 6 with sporadic cases, and then there's some with no cases at all, which is amazing. So let's go a little bit into our testing protocol and the laboratory innovation, because remember, this is about innovation. So you will see that we have, and we still promote, the PCR as a gold standard. And because we are dealing with such small populations, we are very granular in our advice. And so we want to be able to eliminate false negatives as much as possible. But bearing in mind that rapid tests, and you know that WHO and PAHO have endorsed rapid antigen tests, we know that they will be very attractive because they're a lot cheaper. CARPHA produced an assessment tool to allow the member states to not only assess the test kit, and we want sensitivity and specificity of at least 90%, also because we want them to be able to assess how many of the negative tests they will retest with PCR. So we have spent a lot of money on testing. And so we've had to do some innovations to ensure that we are very tight with how we spend our money. And you will see that we've maximized the use of human resources. We've ensured a reduction of electrical capacity. There's been acquisition of new technologies. I can remember our discussions early on when we were deciding not only what to buy, but where to buy it. And we've been substituting old technologies, so we keep on the cutting edge. The diversification of cadre of suppliers has been supported by some of those diplomatic efforts of CARICOM, as you would know. We have now access to the African Medical Supplies Platform. And of course, within the lab, we've done a lot of cross-training so that we have diversification of the skills of the lab technologists that work with us. So this gives you a pictorial view of those cases. The cases per day, the green, and the cumulative, the purple. And remember I told you about that positivity rate. We notice it's only going up, but we've had total unique cases of only 3,607, which is good. That means that most of this is retesting. So let's have a look now at HR innovation, because you cannot maintain support of this nature if you do not protect your staff. And so this is a timeline, a clock this time, which shows you how we have been interacting with our staff to make sure that they're safe, not only physically, but mentally. You will see something called EAP session. That is the Employee Assistance Program. So we have a service which we employ regularly with our lab staff, with our incident management team, which is the think tank of our response. And we also have employed staff rotation, the installation of sanitizer stations. Everyone gets tested once they come into our compound for their temperature for the day. And this is not just the Trinidad campus, but also St. Lucia and Jamaica. And we also even subsidize transportation because we know that public transportation can be a risk point. And so to present, we have not only done these actions, but we have guided it with our workplace protocol, with an updating of the protocol at regular points. But if you know about this pandemic, you also know there's something called an infodemic. A lot of fake news, a lot of vicious rumors. And so we have tried to push back this infodemic using the Regional Health Communications Network, the focal points that we have in every country, established in 2015. And they've been working hard on a common risk communication framework and messaging. This is some of their past work. But really for COVID-19, they have shown a regional policy, a regional communications and national communications, so that there's a commonality in the information and an unpacking of the information. And we have also been working with the deaf and blind community to make sure that our messaging has a great reach. Now, the messaging has been translated into languages by our member states with different languages and also dialects. But you cannot do this kind of work without having experts. So we've had a call for experts of two kinds. First one was the expert advisory group, because we know that we're public health specialists, but this is a clinical disease. And so we asked our member states to nominate Caribbean professionals who have worked with us throughout. They identified the need to train hospital lab technologists. They also advised on the WHO Solidarity Clinical Trial. One of the members is on the Carribean Steering Committee with me. They've advised on the need for specific surveillance for children, and they're working now with us on some mental health modules and also some research that we hope to conduct. But we've also done call for experts from the member states for persons who can support. Now that we know that traveling and going in country is difficult, we have people who we have found throughout our region so that they can lend support as necessary to the outreach of CARPHA in the member states. We had over 260 applicants and narrowed it down to about 98. So a lot of the supporting that we have been doing has been through the production of technical documents, and you're seeing some of them here. But our products include not only guidelines, protocols, but also we do our situation reports, and we've had our 100th situation report some time ago. And the technical advice is not just within health, it's also guidance to the cruise sector. It's also guidance to non-health sectors so that they can safely return to work. And it's also for something that's been very prevalent this year. If it wasn't enough to have COVID, we have had so many elections. So we've done guidance for reducing the risk of contracting COVID-19 during the voting process. So our strategy has been to produce the guidance, and now we're in the training mode. So you see here that we've had over 38 trainings with over 6,045 people reached from 49 countries. So all of our member states and others have joined. And we have been doing, as I said, work with sectors, mosquito-borne disease management, COVID-19 lab diagnostics, and tackling community spread are just some of the trainings that we have done. And we have also had a research agenda. So produce the guidance, train in the guidance, and then research. And to support research generally in the region, the Caribbean network of research ethics committees was reestablished. The executive was reestablished. It's functioning. It's developed a protocol for research in crises. And we're now looking at working on our CARPHA rec. So when we start our research, we have a research ethics committee which will support that research. And of course, I've told you before about the expert advisory group and the research proposal that we're working on for mental health. But in the Caribbean, we're not just one hazard at a time. So we've got COVID-19. This is hurricane season. And because it's raining, we've got a dengue outbreak in some countries. So we had to also focus. The IMT has also focused on building resilience in COVID-19 times. Our support to SEDEMA is clear, and we will support on hurricane season preparedness through mainly SEDEMA, but we've also been working on vector control. We recently launched the EU Zombie Project, 5 million euros to support with vector control. And this is a little bit of some of the work we've been doing with vector control. And I need to tell you that we are aware that there have been, not in the Caribbean, we haven't detected that so far, but supposedly in the region of the Americas, co-infection with COVID-19 and dengue. So let's now get into some of the specific mandates. So it's not only that there was coordination, but we were given mandates. So let me give you an idea of some of the creativity and innovation in this regard. A mandate for joint procurement of medication, supplies, and equipment, CARICOM travel protocols, and resource mobilization for vaccines. So here I show you a picture of the flying heroes of the COVID-19 response, the Regional Security System Air Wing. They have been moving up and down in the Caribbean, mainly the Eastern Caribbean, but we have done some missions to other countries, collecting samples to bring back to CARPHA for testing. Now it is more secondaries. There will be some testing within country because there's been a lot of capacity given for testing. It's one of the best testing responses that the Caribbean has ever had. And why I'm here giving them boxes is that this is a combination now with the diplomacy of CARICOM. CARICOM negotiated with the People's Republic of China for donations, and these are some of the supplies that were donated to Barbados. Procurement. So this is now SEDIMA's baby. SEDIMA was given the mandate to produce a procurement and distribution hub, and this is when they got some supplies to their warehouse. CARPHA supported by doing the equitable distribution using a formula which takes into account the NCD burden, the population demographics, and also where we could, the background illness that is in the country. And now this picture is when we received supplies from Jack Ma, which was negotiated by Dr. Tedros, Director General of WHO. And that's the Canadian government's beautiful flying machine, where they brought supplies in to Barbados for then distribution. So here are most of the players in the security system, along with PAHO. You can see PAHO on the left. And of course, the imposing lady in the center in the rust past suit is the past chairman of Conference of the Heads of Government, the Honorable Mia Mottley, Prime Minister of Barbados. So then the protocols, they mandated the protocols. They wanted a common border policy and protocol, intra-regional travel protocol, criteria for CARICOM countries to enter the bubble, and then a common technical protocol for the CARICOM bubble. And so we've been trying to raise this bubble out of the sea. So to complement this whole issue of travel and tourism, the Tourism and Health Program of CARPHA has come up with some innovative products which we launched this week. I call them regional public goods. We launched, this is the whole timeline of the work that we have been doing with the tourism sector at the regional level, the Caribbean Tourism Organization and the Caribbean Hotel and Tourism Association and the GTMRC. And we have been producing and cementing on a suite of measures that Tourism and Health Program was already putting in place. This whole issue of the TIS system for real-time reporting, the guidelines, not only for the tourism sector, but also the food service sector. We signed an MOU and created the COVID-19 Tourism Task Force. And then PS de Resistance, which we launched this week, are the Healthier, Safer Tourism Stamp, a Traveler's Health Assurance Stamp, which is verifiable, and the COVID-19 app for tracking at the regional level. So this is to support to make sure that our tourism product is a safe one for residents and visitors alike. Here's the app. But you cannot have a novel virus affect the entire world and you do not have access to vaccines. And the COVAX facility, which is partly involving WHO, but really will be administered by Gavi. CARPHA brokered a partnership with PAHO and the EU. EU gave us a pot of funds for health security, which we reworked so that it would be most relevant for the COVID-19 response. And there's a pot of money specifically for vaccines and treatments. And when we were listening to a PAHO briefing on the COVAX facility, and we learned of the need for countries to pay down payments in order to access the vaccines, we decided we would use this money. And again, we used the formula that I told you about, the NCD burden, the demography of the country, and so on and so forth. And we came up with an equitable quantum of funds for all of our member states. But 9 member states went through and agreed that we would pay their down payment using the EU funds through PAHO, and then PAHO would pay to Gavi. So we've paid the down payments. This would be covering for most of the countries 20% of the population when the vaccines are actually delivered, hopefully before the end of the first half of next year, and hopefully before the end of the first quarter, frankly. They will pay the rest of the funding. We're quite proud of this, and we will continue the partnership with vaccines in the lines of regulation to ensure the safety of the vaccines, and if there are any adverse reactions to the vaccines, that we would be able to detect and report. And so all of this creativity and innovation is so that the CARICOM region can return to work safely, they can play safely, and here I show you the CPL. CARPHA supported the CPL tour in the Caribbean, the recently ended one. They can return to school, yes. This is a school child, look how small she is, she has her mask. And this whole issue of supporting safe election periods. And I am finished.
Thank you very much, Dr. St. John. We appreciate your presentation. I appreciate the significant overview and also the efforts on the part of CARPHA and the regional authorities in response to COVID-19. It has been a success story, and we look forward to that continuing to be the case as well. We have a couple of comments and questions that came from the chat. Reference.
Oh, nice. Very nice. What's the first one?
First, okay, there we go. In terms of the workplace, do you think excluding or reducing elderly persons, like workers, from the workplace will serve as a reduction or a strategy to reducing the mortality rate of COVID-19?
Well, I have just become elderly because I just turned 60 last week.
Congratulations.
I came to Barbados in March, and I think a week after, or less than a week after I got here, Trinidad closed its borders. So I have been doing all of the work virtually. So the exclusion needs to be defined, because you can still work and be productive with a virtual setting. And I did not say at the time, but for our employees, we went through that kind of stratification. We have some survivors of cancer, for example, or people who are married to survivors of cancer. And so we have allowed for flexible working arrangements. The virtual, fully virtual, are coming in some days of the week. So the exclusion, and this is very much a creativity here, the exclusion can be creative, and it is more for the safety of the person. But I know that older persons are suffering because they are not interacting with their work or their social mates. And I know this is an issue. This is part of the reason why we want to do work with mental health. But in terms of safety, we have not had a case at CARPHA because of the kind of strategies which we have employed, not just for older persons, because they're young persons in the Caribbean region with NCDs. And in fact, some of our deaths have been younger persons because they had NCDs as well. So I don't want people to think only old people can get this, not at all.
Okay.
So it is definitely about creativity and also about bandwidth. And I'm not sure if we are good with bandwidth in the Caribbean yet.
Well, so far so good for this conference at least. So, that's a good indicator at this point in time. Thank you for that, and we appreciate the actual reference of creativity as a strategy going forward, even when managing some of the considered at-risk groups as well, and also including innovation. It is how you can continue to function along the way. We have a
but because CARPHA was set up, we have a lot of things like the VPN and so on, which are essential for really having efficacious work, virtual work.
We have a question that seeks your opinion on this whole aspect of testing, ranging from antigen testing, which the White House in the US have proven to be actually quite insensitive in terms of like false positive, 30% rate of false positive, and when you contain the virus itself, and also in terms of different types of sampling strategies for PCR, such as sputum versus nasal swab, and also for pooling samples, which
that's another bad word, pooling samples, especially in our small populations. But keep going.
Well, I'm pooling, especially in context of decreasing costs significantly, and also the demands for PPE and the risk of workers. So there are a couple of elements here. There is issue of antigen testing, aspect of the sampling strategy for PCR, and the issue of pooling samples for testing as well.
There are several elements, but at the back of it all is the cost. PCR is really good, and it's really good for active disease. I know what has been said about the antigen test, but 30% false positives or negatives is massive for small populations. And the other thing that we have found when people have a negative test on the antigen test, and then they're tested in the Caribbean with the PCR, is that they begin to doubt and badmouth the PCR, because nobody wants to be positive for COVID-19, even the ones who say it's just a flu, it's a hoax. So there is that political sensitivity as well. But in terms of the different types of sampling, the best is still the nasopharyngeal swab. The spit does not give you enough cells and then can reduce your sensitivity. And this is also part of the reason why we say pooling is a bad word, because the pooling also reduces the sensitivity. And so you will think that you have negatives when you don't. The antigen test has been approved by WHO and PAHO. And I am sure that they are more focusing on the large populations that they're dealing with. Even our largest population in Jamaica is not enough to really say it is large enough to reduce the risk of detecting false negatives. Now, I know that there's some verification studies ongoing in the Caribbean region, and I'm anxious to see them, but CARPHA is going to stick with the PCR and continue to recommend it because of the risk. And people don't understand the scale of COVID-19. It sneaks in the night, it rests quietly, and then it explodes. And when the region is trying to get back to safe tourism, we don't want outbreaks. We've been seeing some recent developments in some of our countries which are really alarming. Next question.
Okay. When you made a call for experts, for support networks to contribute to the effort against COVID-19, what about incorporating non-traditional health sector? And the example provided by this individual who's actually writing from California, they have been able to work with the creative skills community, artists, for example, to work with communities, families, provide them with alternative strategies of how they can actually develop their own skills and cope how the non-health sector can potentially play a role in the coping mechanisms for society as they respond to COVID-19.
I am here for that. CARPHA has done some really interesting work with muralists in some of our member states where they've done paintings on the wall to give messages for NCDs, for example. So we know that communicators, dub artists, who are giving conscious lyrics are very influential, because it's not just knowing, it's being able to influence changes of behavior. Because COVID-19 has been very good at that, getting us where we like to play, where we like to get together for family reunions, etc., etc. So it's not just medical knowledge, it's influence. So I'm here for that. Once they work with us and we give them the correct information so that how it is conveyed does not change the messaging. So that's quite fine. Next question.
In our previous presentation, we made a point that COVID-19 is a significant challenge, but it's also an opportunity to assess, examine, potentially reset our strategies going forward. And throughout the various presentations, both yesterday and today, a common public health issue of health inequities, disparities continue to demonstrate that it's very much real and it's very much alive, especially during COVID-19. In the post-COVID-19 or during COVID-19 world, what are some of the structural adjustments, functional adjustments organizations like CARPHA, regional governments, maybe even at the WHO level, need to consider based on the experiences and the lessons from COVID-19?
Oh, that's a yummy question. So we've already started making the changes. And we had been working virtually before, because with 26 member states and not a lot of money, you have to find ways to convene virtually. But I think what we have done now is to give member states more of a comfort level with virtual work. And we've also had to truncate our support so that we give it in small bites, because people can't look at a computer for many hours and take in complex information for very long. So we've had to find ways to say what we have to say in the most efficient manner. That's why you see that I like not to speak, but to give people pictures so they get many images and understand how things actually work. The other thing is that we are doing a lot more of our advice in infographics, where we do the picture story. The Caribbean loves those picture stories. The other structures that need to change are how we are going to be efficient with the use of our resources, not just human resources, but money. Our cash flow has taken a massive hit because we're so tourism dependent. So how do we get the biggest bang for the buck? And I think the governments are grappling with that now. I cannot profess to discuss government's changes or ministries' changes, but those are some of the structures that we have put in place in CARPHA. We are using a lot of consultants because, of course, of the funding from the international development partners that allows that. I do not want to lose a lot of the brain power that we have in public health, though. I really would not like for people to be lost from public health, because the cadre of public health professionals in the Caribbean, you will see from the way our numbers compare to other numbers in the region of the Americas, you realize that it has to be really top-notch public health practice to protect our populations to that level.
With that, Dr. St. John, thank you very much. Thank you for your keynote address to our conference, and thank you for leading CARPHA and the regional efforts against COVID-19. And of course, not just COVID-19, but all the other health issues that we have to manage as a region, as a population as a whole as well. We appreciate
Thank you.
and we look
This
forward
has been a lot of fun. Thanks so much.
to having you back in person once again with us on our campus and in Grenada in some time to come.
Yes, I would love that.